Welcome to Publishing Educational Innovations. This is part of our Department of Psychiatry Educational Research Learning Series, and I'm Abby Konopasky. I'm the Senior Director of Medical Education Research here in the Department of Psychiatry at Northwell. So, what is scholarly innovation? It starts with your approach to teaching. I'm sure you're all excellent teachers, right? You're knowledgeable, you're creative, you think about your craft, and perhaps you're even scholarly teachers, right? So you draw on the literature and theory as you think about your teaching interventions. You maybe collect data to see how the learners are responding. You maybe interact with your community of practice with other teachers. And all of that sets you up to contribute to the scholarship of teaching, which is public, peer-reviewed, and it's a way to contribute to the field. So there are myriad ways you can contribute to the literature. It's not just a workshop or a new class. A novel technology solution is something that you can consider, a new instructional method, whatever the content, a new assessment method or approach, a new curriculum, of course, but even a comprehensive needs assessment, looking at what the educational needs of your program are. But why go the extra step and seek to publish your innovation? Well, there are a number of reasons. First, it can formalize innovative work, and sometimes even the process of researching and writing about it could shift your practice. It may come from a feeling of responsibility to help learners, instructors beyond this institution or beyond your department. It comes from maybe a feeling of pride in your good work. From the desire to join a scholarly conversation and growing in that way as an educator and a scholar, connecting with others who have similar interests and motivations. And then, of course, it can aid with promotion to associate or full professor. So if I've convinced you to publish your innovation, what next? There are 4 steps: building your team, consulting the literature, asking a question with clear outcomes, and writing an innovation report. I'm going to go through each of these. So first, you need to build your team. In health professions, research is rarely done solo, and the same holds for scholarly innovation research. But you have to be careful about the team that you build. So there are some things you might consider. First of all, expertise. What expertise do these folks that you're considering bring with them that will help you with the project? And this could be expertise in the content area that you're doing the innovation on. It could be methodological expertise, someone who can help you sort of measure the outcomes. And it could be expertise, just someone who's written more papers and has a sense of how to do that process. Consider availability, right? If someone has just started, as a brand new resident, for instance, or something else, they may not be available. So you want someone who's going to be available to do this work with you. Reliability. So I think it's really helpful to have had some kind of joint working experience, whether it's research or something else, with whomever you bring onto your team, so you know that they're going to be reliably there. And finally, thinking about long-term opportunities. Are there folks you'd like to invite onto your team that you'd like to do research with in the future, or that you'd like to build connections with? That too is a great reason to bring someone on your team. Next, you need to see what's already out there. So there are 3 things you're looking for in the literature. First, what's the problem, right? So innovation reports are based in an educational problem. What's the problem and how big is it? And thinking about 3 sets of folks: learners, educators, and patients, although others may be part of it as well. What have people done so far to address it, right? What have been the approaches? And what might be a good approach, right? The literature is a great place to look for gaps. Where do you see the gaps? Reading for what is not there. So here's an example. Let's say you have you're planning an innovation, some kind of innovation around learner feedback. So what's the problem? Perhaps for learners, the problem is perception of the feedback being low quality or not having enough feedback. For educators, maybe the problem is a time issue or accreditation concerns. And for patients, obviously that need for competent physicians, and if they're not getting appropriate feedback, is a problem. What have people done so far to address it? So you look at the literature, maybe you find workshops, faculty development, point of care paper assessments. But what might be a good approach? Maybe you identify that an application at point of care assessment that's an application hasn't been done, right? What is there that you think is a good approach that hasn't been tried? So next, you need to focus your scholarly study of your innovation with a question. The basic question, of course, is, did it work? But that's a big question. So you can focus in on aspects. What worked, right? So what aspect of it made a difference? How did it work, right? Was it through the engagement? Was it through the content? So what were the aspects that made it work? For whom did it work, right? So who are the folks that are benefiting from it, and what was their experience with it, and how did it affect them? And then why did it work? So here are some examples from psychiatry publications that I just pulled from the literature. So the first one has a question of, what effect did an undergraduate medical education curriculum have on knowledge and comfort level with decision-making capacity assessment, right? So that one asks what worked, and they focus in on knowledge and comfort level. The second one asks, who uses the national curriculum in reproductive psychiatry, and what are their educational needs, right? So this is asking for whom did it work, because they don't really know who is using this curriculum, what's the uptake there. And then finally, what are the feasibility, utility, and value of a mobile app designed to collect data on entrustable professional activities, EPAs. This one asks why does it work, sort of what is the feasibility, what do people value about it, and what worked, right? So what do they value about it? So how do you measure the effect of your innovation? One very common way to do that is through surveys, right? We've all seen items like rate your comfort level, how helpful was this, that sort of thing. I think a really important question that's often very useful to ask is, what else should we know that we haven't asked about, right? That sort of thing, just to see the effect of your innovation. Interviews and focus groups can also be really helpful, especially if you're not sure how it works. You can ask folks to just tell you about their experience. What did you take away from this session? Knowledge and skills assessments can be really helpful, especially if your research question revolves around change in what folks know or what they can do. There are written tests, there are observations, often using simulation. And then finally, think about the existing data you're already collecting. Is there some kind of climate survey you already collect, learner performance data you're already collecting, that sort of thing. So once you've got your team, you've consulted the literature, and you've determined the measures that can help you to answer your focused question, you can turn your focus to the publication. So most health professions education journals have innovation reports, but they come by many names. So in academic psychiatry, it's called an educational case study. In academic medicine, it is indeed an innovation report. Medical education calls it really good stuff. Perspectives on medical education calls it show and tell. Advances in health sciences education calls them evaluation studies. Clinical teacher calls them innovation, implementation, and improvement. And finally, medical science educator calls it innovation. But a lot of these journals have some kind of innovation report. But unlike the structure of a standard research paper, introduction, methods, results, discussion, innovation reports address these four aspects. The problem, right? So what was the educational problem that you were trying to address? The approach, what did you do? And that includes what you did for the innovation and what you did to measure. And then outcomes, what were the outcomes of that innovation? And those can be the measures that we talked about before, but also sort of more informal measures like this many people attended, and we planned another session based on the popularity of this one. Those sorts of anecdotal outcomes. And then finally, next steps, thinking about the next steps for the institution, but also the next steps for someone else who may want to do this at their institution. So here's a hypothetical example I created based on this video series, right? So the problem, psychiatry faculty need research training, but they don't have a lot of time. The approach, I'm going to design these micro-learning opportunities online. My outcomes, I have found that psychiatry faculty, after watching these videos, collectively have published 1 million innovation reports. Not really, but would be great. And then the next steps are a Train the Trainer series so that psychiatry faculty can train those across the system, say. So not only are there a lot of opportunities to publish innovation reports, a lot of other scholars are seeking to publish them as well. So how do you ensure you're doing something that has a good chance of getting published? Well, there actually has been there have been a number of research articles looking at published innovation reports and sort of what makes them tick. So first of all, describes an educational problem. It's preliminary or exploratory, right? It doesn't have to be something that's fully formed with a randomized controlled trial and hundreds of participants. It explains what's new, right? So you have to explain that gap, what's new about this. It uses theory or framework as a rationale, right? So thinking about that theory that frames things, and we will have we'll have a video on that as well, because that's a little tricky sometimes. It describes how it was developed, not just what you did, but how did you develop it, right? Because if other folks are going to develop it, they're going to need to know the ins and outs of how you sort of built a team to do that. It evaluates the innovation, including those outcome measures that we talked about. And then it has some kind of lessons learned type of reflection, again, to help folks who might do this at their institution. Discusses the sustainability of it in your department or unit, and the transferability of it out to others. And it mentions the influence of this innovation on the field when we're thinking about the field of medical education. So, what is next for you? First, remember that there are lots of opportunities to publish these scholarly innovations, that publishing them really does make a difference. Think about the 4 steps: building your team, consulting the literature, asking that question with clear outcomes, and writing the report. And then come see me at any point in that 4-step process for support, and thank you for watching.